right, Dr. Ben Weitz, thanks for joining us today on the Happy Whole You podcast.
And thank you for having me. I'm happy to speak with you and your audience.
Well, we were talking right before, and I haven't had a guest to talk about functional medicine. We were also talking about autoimmune management. But before we dive into all the goodies that you have to share, can you just share with everyone a little bit about yourself, why you got into the work that you do, what inspired you, and just a little bit about who you are?
All right. So I'm a chiropractor and functional medicine practitioner, and I've been involved in healthcare for 35 years, a little more than that. And I've always been interested in what we can do to help people become healthier and prevent diseases. And I was never happy with the conventional medical model, which is you wait until someone's sick and then you prescribe a drug to manage the symptoms. And then when those symptoms get worse, you add in additional drugs, and you basically manage this cart as it steams down the hill. And eventually, when it crashes, you say, "Oh, well, we've done everything we could."
Yeah, I can definitely get into, one drug after the other, after the other, after the other. So,
So,
what
I've always said to myself, "Wait, this doesn't make any sense." And then, of
yeah.
course, you see the costs with handling healthcare that way. So, there's got to be a way to help the body to become healthy. Our bodies are remarkable, have remarkable abilities to heal themselves if we can just give our bodies a little help. So, the functional medicine message has always been very appealing to me, and that can be summarized as what do we need to give the body so that it can help itself to heal, and what do we need to take away that's impeding its ability to heal?
I love that. So it's getting to the root and going to the foundations of health for someone to restore.
Absolutely.
I love that. Yes, very good. So, when you see a client, like what are you seeing a lot of right now in or in 2024? So depending on when you listen to this podcast, but what are you seeing a lot of right now that people need support with?
I mean, I see a lot of different conditions, but we decided we were going to talk about autoimmune diseases. So why don't we focus on autoimmune diseases? And because these diseases are very common today and are growing. There's over 100 different diseases that can be categorized as autoimmune, and there's many other diseases like cardiovascular disease that have an autoimmune component.
And so can you explain to everyone what is autoimmune for those that may be curious? They've heard the word, but they're like, but I don't really know what that is.
Absolutely. So our immune system is the way that we fight off problems, bad guys, things that attack our body. So our immune systems really are designed to fight against pathogens. So we're talking about bacteria, viruses, fungi, parasites, etc. We just lived through this pandemic where we were asking our immune systems to play a role. And what happens in autoimmune disease is that our immune system, instead of attacking these outside foreign invaders, starts attacking our own cells. And that why would this possibly happen? What's gone wrong when our body's attacking ourselves? And so there's several different mechanisms. The most common one that's talked about the most is something called molecular mimicry. So what that means is that the immune system, which is primed to attack a bacteria, um, it recognizes our own cells, tissues, and organs as foreign. And that's
Mhm.
because it's attacking, let's say we have a food that irritates our immune system. Creates an allergy or a food sensitivity. So the immune system will create an antibody against that food. whatever it is. Let's say it's gluten or soy. And then if there's a structural protein in the body, let's say in the thyroid, that is close enough in amino acid sequence in structure to that gluten molecule, then those antibodies will cross react and attack the thyroid gland. And then they'll damage the thyroid gland. And then the person will come in with Hashimoto's thyroiditis, which is the main cause in like 95% of the cases in the United States of hypothyroidism.
Mm. So it's like the body is getting confused. So why do you think more people are having autoimmune? Where do you think this is coming from?
Well, there's a lot of thought about something called the hygiene hypothesis, which is the fact that because we try to be so hygienic,
Mhm.
because we're making sure that we're using antibacterial soaps and cleansers, and we're making sure we try to keep our kids from playing in the dirt, and a lot easier to just throw them in front of a computer screen or an
Mm.
iPad or something like that. And so we're not getting exposed to bacteria and pathogens from early on. And so that's believed to be one of the mechanisms. It's, yeah, of course, I get the whole hygiene thing, but it's good for our immune system to constantly be challenged with bacteria. The reason why people get sick is not because they got exposed to a bacteria or a virus. It's because their immune system wasn't effective at fighting it off. So it's
Mm.
important that we get exposed to a certain amount of pathogens from early on. And people who say get raised on farms have fewer autoimmune diseases because they're getting exposed, you know, but with their interactions with the animals and the dirt and all the other materials, they're getting exposed to lots of pathogens, bacteria and viruses, and the immune system fights it off. And that's what's supposed to happen. The goal is not to live in this hygienic world with using, wipes and being covered with masks and everything else.
Yeah. So really autoimmune can start from a younger age. So what do you think about like people that have more kids are born C-section now than ever before because everyone wants to plan their life.
Yes. Bad
Antibiotic
idea.
use. Yeah, so do you think those also play a role in the autoimmune? Like how many, if you were C-section, how many antibiotics you've been on, anything like that? Have you
Oh,
found?
absolutely. There's no doubt. We know that people born, kids born by C-section have less diverse microbiomes. We have all these bacteria that populate our gut and our skin and our vagina and our eyes and our nasal cavities. And the microbiome is crucial for our health. And so, um, how do we get those bacteria? Well, it starts as we're born, as we're coming through the womb. And so when you bypass that natural process, um, we end up being born with less diverse microbiomes, and we have a much higher incidence of gut problems and leaky gut, which allows toxins to get into the system and creates all sorts of problems with digestion. And it's definitely the case that natural vaginal deliveries are going to make for a healthier microbiome and a healthier immune system. Taking antibiotics destroys our microbiome, and we throw around antibiotics all the time. And
Mhm.
many times, this is because the person has a viral infection that hasn't gotten better. And a lot of people, in their mind, if they haven't gotten better, then they need to go to the doctor. And if the doctor doesn't have an effective way to combat viruses, which we don't,
Mhm.
they give you an antibiotic.
Mhm.
Essentially, this screw is loose. So here's a hammer, hit it with the hammer. Uh,
Yeah.
when do they ever say, well, let's see, you have this sinus infection. Let's culture the germs in your sinuses and let's see. And if it's a bacteria, then we'll consider prescribing an antibiotic. No, here's an antibiotic. And
Yeah. Yeah.
most of the time they have a viral infection. It doesn't affect the course of the illness. They're convinced it helped them get better. Doctors have nothing else to do. So that if they didn't hand you an antibiotic, you'd say, what the hell did I come in here for?
Yeah, so antibiotics are not working for viruses, and then if a doctor gives it to you because, you're not getting better, there's also a 30% placebo effect that could happen, and plus the virus is
Yes.
gonna run its course, so you're naturally gonna get better eventually
And and
anyways.
then and then we have all these bacteria that are resistant to antibiotics. So we
Mhm.
have antibiotic resistant strep, which is, creating all sorts of problems.
Yeah. Yeah, it's a slippery slope with antibiotics for sure. So what can people do to, maybe they were born C-section, they can't change their past, maybe they weren't breastfed, maybe they were on a lot of antibiotics when they were younger, and now they're adult and they're waking up to this. What are some tips you have for people to actually restore their microbiome naturally?
Well, all the things you need to do to promote your health. So, which means to get good quality sleep, which means to exercise regularly, which means to be eating healthy. And of course, we have massive debates about what a healthy diet is, and it's
Yeah.
constantly changing. But from a moderate perspective, I think a modified Mediterranean diet that includes lots of different colored vegetables and healthy fats from olive oil and avocado and quality proteins from lean uh, meats and fish and nuts and seeds and legumes, I think is going to provide a really good diet. Um, in terms of restoring the microbiome, number one, we have to stop doing things that are destroying the microbiome. So stop using antibacterial soap.
Mm,
It's damaging, it's harmful. Just use regular soap. That's all you need. Antibacterial soap hasn't actually been shown to be any more beneficial. Stop using harsh cleansers that have antibiotics in them. Stop using spraying your lawns with pesticides. Stop spraying your homes with pesticides. All those things get into your body and destroy your
mm,
microbiome. So first stop destroying your own microbiome.
yeah.
Then to improve the microbiome, we need to feed the bacteria with lots of healthy fiber. And these come from many natural foods like legumes and vegetables and nuts and seeds, and we can consume fermented foods like kimchi and sauerkraut, and these contain probiotics. And then we can also add supplements of probiotics, and then there's prebiotics, which are basically the various forms of fiber. And then we have postbiotics, which are polyphenols and these other colorful phytochemicals that are found in fruits and vegetables.
Yeah. So eating a diverse diet is really important, and we can
Eat,
all get in that routine of eating the same things over and over.
exactly. Eat the rainbow. Go to the natural grocery store and look for organic vegetables that you haven't eaten before and just
Mhm,
stop eating the same, one or two vegetables. And having one vegetable with a meal, that's not eating a diverse diet.
mhm.
You should
Yeah.
have three or four different vegetables, different colors with each meal. Think of every
Yeah.
meal as how can I get more vegetables as well as quality protein and healthy fats in.
Yeah. I know when I talk to people, I'll ask them, how many vegetables do you eat at each meal or in a day, or how many fruits? And it's interesting. Like they're like, well, maybe I eat maybe one or two vegetables a week. Like this is very common. And I know a lot of
Oh
people that
yeah.
are listening, you guys are doing a much better job than the average American. And the average American's eating only about 15 grams of fiber a day, which is your prebiotics, which is what feeds those microbiomes. So Yeah, fiber, I always say like the two staples I look for is the fiber and then the protein because I feel like as a woman I don't get enough protein and then I'm always like okay and I always like looking for good fats. Like if I could do those three things, the first two are really good and then I throw in the fats, then I feel pretty good about what I'm putting in my body.
By
So
the way, did you hear the news? There's just a new report out by the folks who produced the US dietary guidelines. Ultra processed foods do not lead to obesity. We're all confused about this. They're actually good for us. These are the people that are producing the
Oh
US
my gosh.
dietary guidelines. Really?
That that is a flat out lie.
Unbelievable.
How is that even possible? You know, and a lot of packaged foods like have wheat in them, and the wheat in America is sprayed with folic acid, and many
Glyphosate,
people
glyphosate. Yeah.
yeah, and most people can't process that. And then if they have the MTFHR gene, they have an issue with that. I mean, this is see, this kind of information gets put out there and people think like if they're eating to that guideline, then they're doing good. And this is what's being taught at school. So now that they have that,
Yeah,
I don't know how they
let
get
me
away
bring
with
you
this.
some other news. When we talk about eating the rainbow, we're not talking about Fruit Loops.
Oh my gosh, I know. Oh, that's fascinating. Wow. Yeah, I this
So
is
we're
why
all
we have to ask questions and have our own brains. We
yes.
can't we can't just be told things because that's not always so, okay, so they're saying that processed foods do not lead to obesity. This is did you just am I hearing this correctly?
Yeah, the
Oh,
reason why
wow.
we're overweight has nothing to do with the fact that we're not exercising and we're not eating healthy foods. It's because we have an Ozempic deficiency.
Oh. Oh my gosh, I can't. This is oh, wow. Yeah. Okay. So, if people are out there and they're have what are some signs that maybe your immune system is working against you, which it's not supposed to do, but in terms of autoimmune, like what are some signs that your immune system is working against you and people might be like, "Huh, I wonder if that's me." What would they be start
You
noticing?
know, unfortunately, there's no real clear signs because this leads to inflammation, it leads to dysfunction, and, so, but the bottom line is if you have an autoimmune disease, and you might not know, you can ask your doctor, you can look it up, but, the most common autoimmune diseases are uh, hypothyroidism. So that's
Mhm.
probably the most common one. The most common GI disorder is something called IBS, irritable bowel syndrome. And there's actually a big autoimmune component in that. And there's a whole series of other autoimmune conditions.
Mhm.
So we have things like rheumatoid arthritis, and we have Crohn's disease, and we have there's a huge number of autoimmune diseases that people are dealing with, including the neurodegenerative diseases. So then the question is, what are we going to do about these? And what is the answer from the conventional medical world is, well, here's a drug that's going to block part of your immune system. Take this TNF alpha medication like Humira, and these are some of the biggest selling drugs in America. So
Mm.
we're going to combat autoimmune diseases by suppressing the immune system. Are we shocked that we didn't do well during COVID when millions of people are taking drugs to suppress their immune system? No,
Yeah.
that couldn't have been a factor.
Yeah. Oh my gosh.
So, from a
So
functional medicine perspective, instead of just blocking the immune system, let's see if we can figure out why the immune system has gone the wrong direction. So, we
mhm,
need to look at some of the triggers for autoimmune disease. And these tend to come down to three main categories. And these are food sensitivities, these
mhm,
are exposure to toxins, and
mhm,
these are exposure to chronic infections.
mm.
So
I yeah.
most of us don't realize that once you get infected with the virus, that virus tends to stay in your body at some low level, or else you have antigens or antibodies to it that stay in your body for a long period of time.
Hmm.
And they can get reactivated. In fact, long COVID, which is something that's happened to millions of people, is because the SARS-CoV-1 virus ha has reactivated the Epstein-Barr virus or a couple of other viruses that are very common. And once that happens, you create antibodies to that Epstein-Barr virus, then those antibodies cross-react to your own tissues. So let's see, based on someone's history and then doing the right detailed testing, can we figure out what some of these um, triggers are?
Hmm.
And then let's see what we can do to eliminate them so the immune system calms down, so we don't need to use drugs to block the immune system.
Yeah. Yeah, and I would actually throw in a fourth one. This is just my subjective feedback based on the amount of clients that I see. But I find that a high percentage of women that I see that come in and they say they've been diagnosed with the autoimmune disorder usually are struggling with some type of mental health issue. And then I also see a high percentage of them have breast implants. So this is again just my subjective, just
Right.
seeing clients for the last 6 years. And I'm like, huh, I wonder if there is a correlation there. And I do believe that between trauma and emotions, I believe they get stored in the body and they weaken tissue over time. And that's some of my work that I do with energy medicine. And I believe that those impact the biochemistry of the body. And so, it's this whole chain reaction of events that are happening. And if we bottom line it, it comes down to, like you're saying, the what we're exposed to, the chemicals, our microbiome, our stress levels, like, and we have to get back to the basics. Like the basics are so important when it comes to health, playing outside, getting sunlight, eating nutritious foods, having positive conversations. And I think we think it's some like miraculous thing that we have to do to heal our bodies. And it's like, we just kind of got to go back to the basics, you know? But
Yeah,
yeah.
breast implants are definitely a source of toxins that enter our bodies, and even the saline ones are packed in silicone containers,
Mhm.
and that is affecting your skin and getting into your bodies. And, I think that there's this thought that they're safe, and I think that they're really not.
Yeah, I had mine removed about 3 years ago. We just did actually a segment, it hasn't aired yet. We did a new segment on this a couple weeks ago. Myself and a couple other gals that had their breast implants removed. And I thought in my early 20s that, oh, if I do this, it's safe because it is saline. I was never told that there was silicone in them. I was on mental health medications. There was no reason why a 22, 23-year-old should have been able to go under the knife and alter my body. The only thing I was told is, oh yeah, you'll have to just get these replaced. And I
Yeah,
started to
so they're
get
telling you they're guaranteed to leak.
right, yeah, because you have to get them replaced. But, when you're not even thinking of that, and then, yeah, and then it was interesting because when I went to go get them removed, I went to multiple doctors, and I was having more joint pain than I had ever had in my life. And I was like, "This doesn't make any sense," because I mean, I have with my wellness center, I have access to so many wonderful tools and I eat healthy. So for me, it wasn't computing of why my body was feeling the way that it was. And it was progressively like getting a little bit worse every year. So then I did look at the implants. And every doctor I went to when I told them I wanted them out, tried to talk me out of it. They're like, "Oh, well, you're gonna be flat and you're gonna do it." It was all like based on how I looked. And then they would ask, "Well, what does your husband think?" I'm like, who gives a shit what my husband thinks? Like, I want these out. What is the safest, most effective way to do this? And when they took them out, one of them had mold in it.
Wow.
And that my body was encapsulating the implant because my body was rejecting it because I had the tissue tested. And I'm like, I want pictures of my tissue. I want pictures of the implants. I want the implants when I leave here. And I want the results. And my doctor confirmed that, yeah, your body was trying to get rid of your implants. It was rejecting them.
Absolutely. Mycotoxins are one of the toxins that are common triggers for autoimmune disease. And
Mhm.
then the breast implants, a lot of times the capsule gets attached to the inside of the body, to the chest wall, and is very difficult to scrape it off a lot of times.
Yeah, yeah, yeah. It was, I mean, it was a major procedure. I mean, it was very expensive. It was a major procedure. And, for women out there that feel like their breast implants are making them sick, you're probably right. And the fact that insurance doesn't cover to have them removed is wrong, so wrong. It's like we don't deny medication to a type 2 diabetic when they've chosen to put bad things in their body and get type 2 diabetes. We don't, refuse someone who has lung cancer because they've been smoking their whole life. We don't refuse them treatment with their insurance company.
Oh,
So
they try,
so
especially when we had pre-existing conditions.
oh, yeah. But it's just fascinating because women have to jump through hoops for this, and people may say, "Well, you chose to put that in your body." Well, we all choose to do things, and during the time we think it's okay, we think it's safe, and then come down the road, we realize that, yeah, that wasn't safe, and I was never told what, ingredients were in this. I was never given that black box warning, which I think they didn't even start doing black box warning for breast implants until 2020 or 2021. I mean, what medical device gets to be implanted in somebody's body because it is considered a medical device and not being told the side effects or what's in it? I mean, it's insanity. But anyways, nevertheless, I see a lot of women that the correlation between mental health challenges and breast implants with being diagnosed with autoimmune, and I just find it interesting.
Absolutely. And,
Mhm.
the mental health issue goes both ways. I see a lot of patients with depression and anxiety who get better when they clean up their diet and
Mhm.
balance out their micronutrients and get the right essential fatty acids and balance their blood sugar and do all the things we know that's going to make their body work properly
Mhm.
or
Yeah.
closer to optimal.
Yeah, it comes back to those basics for sure. So, Dr. Ben, what would be if you had 3 tips to give people to just shift their overall trajectory of their health? What would those 3 tips be? Or maybe what are your non negotiables when it comes to your health?
Um, uh, I tend to be pretty rigid on following my program, so it's one of the reasons why I'm not very fond of traveling. But I think food has to be number one. You've got to eat healthy and what's healthy for you. And number two, you got to get your exercise in, and number three, you got to get your sleep in.
Mm, yeah, goes back to those basics. What's your favorite food?
What is my favorite food? I don't know. I have a favorite food. I love avocado. I
Oh
love
yeah.
extra virgin olive oil. I love nuts. I love having my omelet in the morning because I look at eggs as this great vehicle for getting all these vegetables into my
Mm,
self in the morning. So I think breakfast is so important. Unfortunately, today it's become common to try to promote your health by skipping breakfast. This is now called intermittent fasting. It's
mhm.
interesting. I've been involved in this world for 35, 40 years. And I remember when the reason why everybody was fat was because they were skipping breakfast. And for years
Yeah.
we told everybody they had to eat breakfast. And then about 10 years ago, all of a sudden, the key to being healthy is to skip breakfast and don't eat until noon.
I
And
know, yeah.
I know that is helpful for some people, but for me, it's never worked. And so I end up having at least 5 or 6 different vegetables in with my eggs in the morning. So that's one of my favorite meals.
Yeah, I love that. Yeah, I always say though, there's no perfect diet for anyone because what is you're sensitive to may be different from what I'm sensitive to,
And it
and
can change over time.
yeah, exactly, exactly. So yeah, and I think that people are so confused when it comes to nutrition as well because of advertising and because of, the stuff you just read to us. I mean, that's oh
Well,
man.
you have to understand when it comes to the studies that are supposed to validate different ways of eating, they use these food frequency questionnaires, which are the most invalid way of testing different diets. They're literally asking people, how many times in the last month did you eat broccoli? Are you kidding me? It's so inaccurate. It's just
Yeah,
unbelievable. They would never test drugs or anything else that way. So we shouldn't be
yeah,
testing meals and food and diets that way either.
yeah. Oh my gosh. So much good information. Thank you so much, Ben, for joining us today on the Happy Whole You podcast. I appreciate you coming on.
And thank you. And those who want to get in touch with
Oh,
me,
yes, please tell us, and I'll put this in the show notes, you guys.
yes, you can go to my website, which is drweitz.com, drweitz.com, and you can learn more about me. Also, check out my Rational Wellness podcast, available on Apple, Spotify, YouTube, etc., for more information about functional medicine.
Yes. Oh, you guys go and follow, and I'll put all these in the show notes. I can't believe
And
I almost
and by the
forgot
way,
that.
my office is in Santa Monica, California, my White Sports Chiropractic and Nutrition office. And so we also offer chiropractic care for musculoskeletal conditions, as well as functional medicine nutrition consultation. So you can seek me out there.
Awesome. Thank you so much for joining us today and appreciate you sharing your knowledge.
And thank you.